Many clinics are trying to really, be a little less rigid about how they're able to help some of their most vulnerable patients. So there's clinics that have more flexible scheduling. They may have walk-in hours when they'll be willing to see patients if they show up at any time. There are clinics, I know you may have talked to some of the providers at these, but where they're offering certain patients some of whom may be experiencing homelessness, financial incentives just to help them come in and stay engaged in care, just with the idea that you're just giving people one extra reason to come in when they have all these other barriers to care. We also support transportation assistance and try to help with linking people to housing support, so to try to help get all their basic needs met. Street medicine teams have really shown their ability to do some important work in this space. So as I mentioned, it can be hard for patients who are experiencing homelessness to actually make it to a clinic at a certain time. And so what street medicine really is a model of care where we're bringing the care to the patients where they're at. And a lot of these teams have to, they really have to establish rapport because many of the patients have had such negative experiences with either the healthcare system or just overall, big systems of government or other kinds of services. And so they build rapport, they check in regularly with them. We've been lucky to support a couple of street medicine teams from community clinics and other organizations where they've been able to do this, and they go and they give them weekly pill packs. So that's been a really great intervention to really, not just check on them, but actually do those pill pack deliveries. So that way they're not losing their meds, either because they got robbed, they had to move, or their stuff got taken in some sort of sweep. So those are some ways in which we're really trying to help reduce the barriers to care, to help because when you do establish a rapport with the patients, you bring the care to them, they want it. So that's the thing, is people do want to take care of themselves. They want to feel better. If you have uncontrolled HIV, you don't feel good, and you're going to be much more sensitive to getting different, infectious diseases and other complications. So patients want it. It's just there's a lot of barriers to the traditional healthcare model.